Some of the patients who left Life Esidimeni facilities arrived at NGOs without their proper medical history and other documentation. This is what the Life Esidimeni Inquest heard this morning from lawyers representing Takalani and the Masego Home for the elderly in Krugersdorp. 37 mental health care users died at both homes during the crisis. A total of 144 patients died of hunger and dehydration after being transferred from Life Esidimeni facilities. SABC News Senior reporter Chriselda Lewis is on that story for us, and she joins us in studio live. Chriselda, of course, another day of grilling of the conditions in which the patients left Life Esidimeni.
Well, that's right, Nompo. While 37 mental health care users died at Takalani and Masego Homes, as you indicated, it's still unclear how the deaths were spread between the two homes. So lawyers representing Takalani and Masego Homes told the court that some patients only arrived at their facilities from Life Esidimeni with minimal information about their medical history, and those that did come came through with very little detail. So the former managing director of Life Esidimeni disputes this, saying as far as he was aware, the patients left his facilities with adequate information and he doesn't know what happened after they left. Let's take a listen.
The instruction that I received from clients is that the mental care users that were received by them had no recent periodicals. What's your comment?
My comment would be similar as previously. I cannot account for what happened after documents were handed over to the Department of Health officials. Between leaving Life Esidimeni and reaching the destination NGO, that was totally out of my hands.
But to that question, is that the instruction that I received from clients is that some of the mental care users arrived with only Form 3, which is the discharged form, and that form had only brief notes on them. What's your comment?
All documentation as detailed in our discharge procedure were handed over to the Department of Health officials. If forms were lost after they were handed over, I totally had no control over it.
Well, Nompo, meanwhile, a lawyer who was representing Daphne Ndlovu, a social worker at the Takalani Rehabilitation Centre, who also testified, you'd recall, before the arbitration hearings that were led by retired Justice Dikgang Moseneke, told the court of a staggering number of patients who arrived at that facility from Life Esidimeni without discharge summaries. Let's hear that.
Doctor, the point that I'm trying to make before this honorable court, like I've already said, is that my client, Daphne Ndlovu, she's going to testify that 60% of the patients that Takalani Care and Rehabilitation Center received from Life Esidimeni, they did not have medical records. That is the point I'm making before the court.
My lady, I will reiterate, it was not my responsibility to manage in transit of the mental health care users and their documentation. I therefore would like to state that it was not the responsibility of Life Esidimeni to manage patients and documents in transit. They were handed over to the Department of Health officials.
Well, Nompo, cross-examination continues at 2 o'clock, and we're expecting the lawyers to wrap up the cross-examination of Dr. Morgan Mkacho, who is the former managing director of Life Esidimeni. We're expecting a new witness to take the stand tomorrow.
Thanks very much, Chriselda, for that report.